Right, guys, so we're back here with our final lecture for the semester. So we're going to talk today about the genitourinary tract. First off is the urinary tract. This removes substances from the blood. It also regulates certain body process. And most importantly, what it's known for the most is it forms urine and then proceeds to transport it out of your body. Next, we have the genital system, which is um, used for reproduction. And then the defense of the urinary tract. We've talked a lot about defenses in the last kind of lectures. So let's bring it into this and see what it kind of looks like. So defenses is the flushing action of urine. Most bacteria is adapted to adhere to cells of the GI tract and cannot gain a foothold in the urinary tract. And right here, I wanted to kind of show you kind of anatomy-wise. We have the right kidney, left kidney, the ureters, your pelvis, your bladder, and your urethra. Next, let's talk about the normal biota for this genitourinary tract. Exact microbial composition varies from males and women, or males and females. For the female, the urethra is 3.5 centimeters, which is kind of short, and it can be a pipeline for microbes from the anus. Next, we have the male. Men's circumcision can change the composition of the known normal biota from the penis and perhaps the urethra. So let's now look at the male genital tract compared to the female genital tract. So, and kind of normal biota in these. So normal biota in the male tract or male genital tract, many of the same residents as the external portions of the penis. Microbiota shifts kind of in the when sexual activity begins. And microbes associated with STI can help residents in the genital tract. For females' genital tract, the uterus and or organs above were thought once to be sterile. The vaginal canal is colonized by a diverse array of microorganisms. Um, the microbial makeup of the shifts dramatically during pregnancy as well as your menstrual cycle. And biota for the postmenopause women usually remains stable. Next up, we're going to kind of talk about some urinary tract infections. First, we have cystitis. Cystitis is an infection in the bladder. Signs and symptoms, you kind of have some pubic pain, urges to urinate. It may kind of hurt. And when you urinate, you could have some cloudiness of your urine or even some blood in your urine. Next, we have the pyelonephritis. This is an infection in your kidneys. Remember from the previous slide, we had talked about your kidneys up here. So signs and symptoms, you may have back pain, you may have a high fever. It can result in permanent damage to your kidneys, so you need to be very careful if you do have this. Urethritis, this is infection of the urethra, causative agents of urinary tract infections, your Escherichia coli, it causes about 80% of UTIs. You have EP or UPEC and EXPEC, which uses adhesion to attach the urinary epithelial and exhibit kind of motility, which allows them to travel among the mucosal surface, and is transmitted from the GI tract to your kind of urinary tract. So here's your kind of typical, most heard of urinary tract infections and kind of about them. Next, we're going to talk about your vaginitis, your signs and symptoms, and what may be causing this. Um, so, vaginitis, signs and symptoms is inflammation of the vagina. It's characterized by some degree of vaginal itching. You may have some discharge as well as burning that may happen if you have this. Uh, it's kind of the causative agent is the Candida albicans. That was a mouthful, which aka yeast infection. It's the easiest way to do a lot of these things to know yeast infection. Um, so yes, so if you have vaginitis, you may have burning, itching, um, kind of some discharge that's happening with it. All right, next we're going to talk about vaginosis. So, what time frame is this common to get vaginosis? You may be wondering. You may be wondering, do I get it when I get my period? Do I get it whenever I'm like 30? Do I get it when I'm in premenopause, menopause? No, you actually get this. Many women get this during childbearing years. Is typically when people get this. Um, so it's inflammation of the vagina and it produces discharge with kind of this fishy odor to it. And it's as well as itching that can happen. It's very common to have itching with the fishy odor. What is it likely a result of, you may ask? So this is kind of a likely result of kind of a reduction of the back toe bacilli in the vagina, which leads to sometimes infertility if you get it earlier. The most common time, like I said, is during childbearing years, but that doesn't mean that you can't get it earlier. Um, you can have an ectopic pregnancy that it's led because of, or PID, but this is not sexually transmitted. And right here, I kind of have the clue cell in bacterial vaginosis, so you can look at that, take a minute, and just kind of look. Um, so here's your normal vaginal epithelial cell. And this is your vaginal epithelial cell with numerous bacteria. That's your clue cell. Next, we're going to talk about prostatitis, which is like it kind of prostate. It's in the name of it. So it's inflammation of your prostate gland. Um, so you may have acute and you have chronic. So acute is virtually always caused by bacteria, and it's usually normal biota from the GI tract. Um, your chronic can also be caused by bacteria, and it's often kind of this unresponsive to antibiotics, which is kind of scary that you can't fix it with antibiotics. Typically, you can fix things with antibiotics, but not this. Um, your signs and symptoms for this are kind of you have pain, men have pain in their groin area, their lower back. They tend to feel the urge that they have to urinate quite often. And there also may be blood that happens in the urine when you have this, as well as painful ejaculation. So for men, this um, kind of situation right here can be very painful. You know, it's first of all, they have inflammation, so your body's going to send in multiple responses that you have inflammation. You're having all of these signs and symptoms of pain. All of these have pain while peeing, and so this can be very difficult for people. This can be very difficult, not just this situation, but any of the urinary tract infections, very difficult to get over. Um, so it's important, we're taking care of ourselves and whatnot. All right, next we're going to talk about syphilis. So, when is it? All right, when was it first recognized? Is my first question here. So, it was first recognized in the 15th century in the country Europe. So, scholars originally concluded that syphilis was introduced to the Old World from the New World. So Old World brought into the New World. It was recently analyzed and found that the cause was because that this disease traveled from the Old World to the New World. Um, so scientists, this part is kind of whenever I read into it and I learned more about this, I was surprised that scientists unethically studied this syphilis and its natural progression of this disease without treating the subjects that they had. So they knew they had it, but they would not treat them because they wanted to study it further. We have primary syphilis. Your primary syphilis is the car can car so this is when you have kind of these small red hard bumps that kind of appear on the sides of where the pathogen would enter. It occurs internal and external genitalia, your lips, your nipples, your oral cavity, your fingers, and around your anus, which sounds super painful. Next, we have kind of your secondary syphilis. Um, this is you kind of you have a fever, a headache, a sore throat, or reddish brown rash all over your skin, the surface of your palms, your soles of your feet, and you can also have a hair loss with this. So very, very painful if you have the secondary syphilis as well as the primary. Both are very painful. Both do not sound fun to have. Right? And finally, your genital herpes. So you may have I included a picture right here. That is an example of your genital herpes. Your herpes simplex virus, HSV1 and HSV2. Kind of you may have different signs and symptoms that come with your genital herpes. Some signs and symptoms include single or multiple vesicles of genital or vesicles on your genital, on your thigh, or on your buttocks. Your vesicles are filled with this kind of clear fluid, and so again, it can be on your genital, your thigh, and your buttocks, and it is very, very painful to touch or to have anything like hit it. So, um, and it can reoccur. It's a reoccurrent episode of these kind of lesions due to this kind of viral lactancy. So again, if you have genital herpes, this, like for example, this one popped up on this person's lip. I'm sure that was painful for them to eat or have anyone touch it. I, you know, they're again, like I said, they're different. They're fluid-like and they're fluid-filled, and they can show up in different places all over your body and can appear later on in the future. It's not just a one-time deal, it pops up. It's a recurring thing. But anyways, it was a pleasure. I hope you enjoyed this lecture and happy holidays.